With this particular type of stroke, we know that it's associated with very poor outcomes. So up to 30% of people will die within the first month. There's evidence that people that get treatment quicker have better outcomes, but at the moment we've got a very limited understanding of who's getting treatment the quickest and actually when the treatment needs to occur to have the best outcomes. So our research is going to be focused on answering that particular question. The most common form of stroke is ischemic stroke, which is around 80% of all strokes. And we know with those forms of stroke that you can get particular medications within around 4.5 hours to achieve good outcomes. And there's also some forms of surgery that can be performed to improve outcomes for those people. And we know much more about the length of time that people need to get to hospital to have the treatment within. With subarachnoid hemorrhage, it's been much less studied, so we have a very limited understanding of what that time window is. And by doing this research, we'll be able to properly define the optimum time window, and that will mean that we can raise awareness around how quickly people should get to hospital with these conditions. But more importantly, within the healthcare system, we'll be able to understand how to prioritise cases and to understand which patients should be treated when to make sure that everybody gets the best outcome. So it's a 3-year program of work, and in the first part of the study we'll be gathering the information on the lengths of time that people are treated and their outcomes. And then in the second year of the study we'll do some of the more in-depth interviewing work with the patients, their families, and also the treatment teams. So that includes the paramedics, nurses, neurosurgeons and neuroradiologists that treat the cases. And then in the later part of the study we're going to run a range of workshops in the different locations we're working in to try and come up with these interventions to streamline the pathway for people that have suffered from this form of stroke. So ultimately at the end of the study what we hope we have is a really good understanding of the optimum time window for people getting the treatment for subarachnoid hemorrhage, and also ways that we can make that process as smooth as possible for people, irrespective of what part of whether they live in an urban or a regional location, and taking into account all of those factors. So to really design a streamlined care pathway for people that suffer this form of stroke so that they can receive the treatment they need.